Your life now.
Can start.
Yes.
All right. Good evening, ladies and gentlemen. We are sorry for starting this broadcast late. You are welcome to Mindway for Life and Living. Mindway for Life and Living is an initiative of the Netwealth Group to help you to actualize your potentials, cope with normal stresses of life, and work productively. Today, we are going to be looking at something that is very important and genuine. In terms of the drug use disorders that seem to be ravaging the whole of society. Today I have with me Mary Idoko. Mary Idoko is a clinical psychologist at Netwealth Medical Services and Rehabilitation Center, and is also the programs officer for the Netwealth Rehabilitation Initiative. Mary, you are welcome.
Thank you very much.
All right. Yes. So today we are going to be talking about screening, assessment, and treatment planning in drug use disorders. Screening, assessment, and treatment planning in drug use disorders. In the first instance, what do we mean when we say drug use disorders? A lot of people think that anybody that uses drug is having problem. While we know that society frowns at the use of drugs, but we as doctors, as scientists, as people of knowledge, we know that it's not everybody that uses drug that has drug use disorder. Now, the question is, at what stage does someone have drug use disorder? Where what the layman talks calls addiction, what we usually would like to say dependence. Is drug use disorder the only reason or the only thing that is negative about drug use? We have other areas where we talk about harmful use of drugs, binge drinking, and so on and so forth. But at what point and how do we get to now say that somebody has drug use disorders and so on and so forth? These are some of the things I want to discuss today. And that takes us to the issue of screening, assessment, and treatment planning. We need to screen before we now say, okay, we are assessing holistically and planning the treatment for the person that has drug use disorder and all that. And before we now talk about getting into rehabilitation, treatment, and all that. So today, like I said, I have with me Mary Idoko, who is a clinical psychologist and is actively involved in this issue of treatment for people who have drug use disorders at our treatment center. Now, Mary, you are welcome once again. All right. So now, when we say screening, what do we mean by screening?
Well, we call it a preliminary test.
Yes.
To ascertain the existence or non-existence of, in our own case, drug use.
Okay. So a preliminary test. All right. So that means that okay, if somebody says it comes to the center,
Yeah.
or comes to a treatment facility and says that, okay, my child is using substances, please help me to test this child and all that. But the father many a times already know that this person is taking substance. So why do we then still need to screen the person?
The screening will help us determine whether the substance used is mild,
Okay.
moderate,
Okay.
or serious. When we
Okay.
talk of serious, means that the person has a high risk of addiction.
Okay.
You understand? If it's mild, it means that he's not using well enough for it to be a problem yet.
Okay.
But if it is not handled on time, it may develop into a problem.
Okay.
And moderate means that he has a higher risk than the person who's mild. So generally, just let's also understand the level, of the use and what interventions we can use to help them at the different stages.
All right. So to steer this discussion, I usually will say that it is not only drug use that we do screening.
Yes, of course.
Yes, it's not only drug use. You have worked as a development person in NGOs and all that, and especially dealing with the issue of HIV and all that.
Yes.
Can you bring to bear your experience in that field in terms of screening and then going further, friends like.
Okay, let's take for example now in HIV test. Let us take for example now women in pregnant women generally. Part of the routine test when you come in, one of the first tests you run when you come in for your antenatal, the first time you come for antenatal, it's a HIV test.
Okay.
And why is that necessary? To know whether, you understand, the mother is infected, and if she's infected, there's a different model of treatment for her, different from what they would give the uninfected mother. Not just that, if she is already infected, we get to know, okay, has she been on drugs? Has she started her drugs and medications? If she has not, you know, there are a lot of things. They check the level of infection, and then they know how to handle it to make sure that the fetus is not harmed. You know, that also is a screening test. You know, what it does is that it helps us treat the patient better. But it's the first step just to say this person is positive or not. There are other tests that will go on to determine, okay, the stage and then whether what can be done.
Okay, so bringing it to bear in terms of substance use now, why do we actually need to screen for substances?
Why we need to screen for substances? Because a lot of people, you know, are actually abusing substances. But because it has not become a problem, you know, nobody knows. That is it. And not just that, but there are a lot of people on the threshold of addiction. And if they are caught on time, we'll be able to help them not to fall into addiction. And even those who are using mildly, with education, you know, they can actually be, you know, taught to know how to handle their use so that it doesn't ever become a problem for them.
All right. So, viewers, one of the things I did a research a few years ago, and that was I was looking at people who come to the hospital, go to the hospital for other reasons, medical and surgical reasons, and all that. So I looked at how doctors are able to detect if they have substance use or substance use disorders or harmful use and all that. And my result was to the fact that not more than 20% of doctors will actually ask. What do I mean? So it was just 20% of cases that they are able to sense people who had substance use disorders, because many a times people don't give attention to that area. And I always use another example. And if you go to the hospital, you usually will get what we call vital signs.
Yes.
And the vital signs, what do? They will take your blood pressure and all that. I say, so why do they take blood pressure all of the time?
Well, because one, high blood pressure, hypertension is endemic in our society.
Exactly.
And because of that, we have it has to be caught on time. Exactly, because the majority of people have it and don't know.
And they don't know. So if you go to the hospital for any other reason, whatsoever reasons they are going to the hospital, they will take your blood pressure in order to be able to catch you on time, so that they can prevent the complications and all that. So the idea is that the same thing should be done for substance, because we know that many young people mostly use substances, and it seems as if it has become endemic in this environment. And not only that, even the aged use it now, and all that. So screening, we are saying that if people go to the hospitals for any other thing, they can be screened, and we detect if somebody is using substances and all that. Okay, now I will go to the next area. When you now say screening now, what are the different modules or types of screening that we have? And because is that not going to make things more expensive for people and all that?
Well, this screening we are talking about, they are in forms of question. We're not talking about running blood tests.
Okay.
No, we're not talking about drawing blood. It's nothing invasive.
Okay.
You know, they actually a questionnaire that can actually be answered either individually or, you know, through interviewer.
Yes.
So they are nothing invasive, nothing, and it is at no cost.
Okay.
You know, So those are the major screening for.
All right. So can you give example of
We have the assist,
okay.
alcohol, alcohol and
Okay,
substance.
so I would say
I'm trying to get
alcohol, smoking, and substance involvement
yes,
screening test.
good. In fact,
So
that's a
that
major.
assist is an acronym, isn't it?
It's an acronym.
So
Sorry.
it says let me state it: alcohol,
Smoking
smoking, and substance involvement screening test.
tests.
So
It's a mouthful.
Yes, well, it consists of just 8 questions.
Yes, just
But
eight
of course,
questions.
those 8 questions now look at the different groups of substances and drugs,
and then
including alcohol and
yes,
tobacco.
and the lifetime or recent usage of
Yes.
those same.
So in the last 3
drugs.
months,
Yes, and
or in
lifetime
the
ever.
lifetime,
Yes.
and all that. However, viewers at home may still be wondering, what about the urine drug test that we do? Is that not also screening?
Well, that is a test we can do to confirm, but it's not a general screening
All right,
test.
so that is not
It's
a
a
confirmatory
confirmatory.
test. Is it screening test too?
Yes, but, but it's
But
not like
it does not tell us about the
the
severity,
use or not. It just says
yes.
person used or did not use.
Yes.
It doesn't tell us, okay, used 2 months ago, used 1 year ago.
Beautiful. So at the end of the day, if Dr. Okono, that who doesn't take cannabis, smokes
a little,
half a wrap of cannabis, and you go and do urine drug test now, it will show that
it's positive.
The person that have been taking it regularly in the past 3 years, it will also show positive. So how do we now know that this person just used it and this person has been using it for long? That is why the urine drug test, it just tells us it's there or it's not there. It does not give us any historical picture. And of course, it's more expensive. It's more expensive because at least I think it's about 4,000 something for one strip and all that. But this one is a questionnaire. Well, I won't say it's free because you have to pay for the service, but it's cheap. It's a questionnaire and it gives the history to say in the lifetime, in the last 3 months.
And that is very, very key.
Yes.
Very key because it also determines the kind of intervention we'll give.
All right.
You know, if you know this person has not taken in months, you know, and he has abstained from them, a different kind of intervention. It will be different from the person who has never taken. But once you say he has never taken, the assist is no longer used. And then for the person that has been taking regularly and is still using, there's a different level of intervention. Because okay, he's still using. We also need to know, is he using often? Is the use tending towards a problematic use, or is still something safe? And then we know the kind of interventions we can give them.
So who should be screened in terms of maybe of the population that could be screened, and then we now go on to talk about the settings in which we can conduct the screening.
I think the only persons that should not be screened are babies.
Okay.
Young children, very young children, because the likelihood is much lower. You know, just like a child doesn't go to the hospital and you go on VP test for the child. Yes. You know, but apart from that, every adult, young from, in fact, I think every teenager from teenage down to old age, you know, should be screened at least once or twice. In fact, as far as every time they come into a clinical setting, they should run that screening.
They should do that screening.
Especially from the primary healthcare.
Okay.
Primary health centers, centers.
So, is it only in the health setting that people can be screened?
No.
All right.
Schools.
Yes.
People can be screened in schools, even in churches.
Yes.
You know, we can run some screenings in churches too. I mean, when we're running HIV programs, we went to schools, went to churches, you know, went to institutions, organizations, you know, and screens. So it can actually be screened anywhere.
Anywhere. You know, people in motor parks.
Yes, motor park markets. We've done that. We've done HIV testing in markets. You know, motor parks, yes. Wherever we have adults. You know, whenever we have adults, grown adults, young people, so long as it's a setting that can be organized and we can always run
can always do that screening.
And the advantage is that it doesn't always have to be interviewed. You can always hand out the forms and they fill them in, and they give it to us, we do the
Although
calculations and co.
the acceptable norm
Yes,
is to
exactly.
say is interviewer administered,
Yes.
especially the assist. Of course, I know that there are other forms of screening tools that you can just hand over, but assist is particularly um, designed so that the interview we interview the person
I know what
and know what to write and all that. Because when you finish, you give the feedback to the person. So if the person is the one administering it by himself, that becomes a little bit more cumbersome. But the assist is designed to be interviewer administered. All right. So if somebody goes through screening, what are the possible outcomes that can, in terms of severity and all that?
Okay, there are three possible
Okay.
outcomes.
Mm-hmm.
One could be mild,
Mm-hmm.
then the other moderate,
Mm-hmm.
and then the other is I'm trying to get the right
High
word now.
risk or
High
severe?
risk, yes, or
Mhm.
severe.
Yes.
And just like the words say, I mean,
Mhm.
somebody who has a mild, you maybe use it occasionally, socially, once a month, you know, does not have cravings or whatever. It's mild use. Because now we can just psychoeducate the person, let him know the risk and everything, and fine, and educate him. Then we have the moderate. The moderate means that is using more often than the mild use, but not probably, but not, it has not become problematic because you can actually do without it. You can say, okay, maybe once every 2 weeks, you know, or once in a while when I go out with the guys on Fridays, you know, and things like that. But but when it becomes high risk, it means that it has gotten to a level where he's taking it probably 3-4 times in a week. You know,
so that person is likely going to be dependent.
Yes.
All right. So like we said, that the screening is not diagnosis; is just because you know that the thing is there.
Yeah.
So there's this story. I mean, this talk about the issue of brief intervention as against referral for more expert treatment. So, do you want to say anything about brief intervention?
Yeah, just I'll briefly talk about brief intervention. And that is to say that the brief intervention, normally one of the first things we'll do is that, I mean, if the person is mild, you know, it really doesn't need the brief intervention per se, just psychoeducation and good. We actually use brief intervention mostly for those who have moderate use.
Yes.
You know, because there's a certain level of risk, just that it's not yet high. You know, so we educate them, and it depends on how close they are also to becoming high risk. You know, more often than not, they are giving plain brief intervention, and a lot of times they are not necessarily referred for treatment or for further.
Yes.
But the person who is high risk and close to dependency always will have a brief intervention and referral. It's part of it.
All right. So when they talk about brief intervention and referral, now we are talking about people from the other primary setting or the secondary care setting, or people who are not in specialized treatment um, facilities.
Yeah.
But such referrals are usually the ones that we get at Netwealth Medical Services because we are a specialized treatment facility, and so referrals, we are not the one that refer people. People refer to us most of the time because we are experts, specialists in that area and all that. So we provide that care. Yes. All right. So what we're trying to say is that it's not everybody that uses drug that is dependent on drug
or is even at risk of dependence.
or even at risk of dependence. So it is the person that is at risk of dependence that we usually will intervene to make sure that they don't go on to dependence. Or the person that is not at risk, we give them education such that those kind of people will not progress to having dependence and all that. And then the person that is dependent will now take him for treatment. And that's is what we're talking about. And we don't just do treatment anyhow. And that takes us to the issue of the assessment that we talk about. So when somebody has gone through screening and then we say assessment, what do we mean by assessment?
Assessment goes further.
Yes.
You know, to identify how far the use of the drug has affected his life in every area.
Okay.
We're talking of legal issues, his family relationships, his job, his income generating abilities, his psychological health. That's what an assessment does now. So assessment is done after we have done the initial screening.
Okay.
So we know how serious. That will also help us understand the the severity, of the drug use.
Okay.
I think that's because
Okay.
the screening tells us that even the high risk says this person has a very high potential of being dependent, or it's already dependent, but more often than not,
Not even be dependent.
yeah. But the assessment tells us, this person has become dependent, because there are questions they ask. Say, okay, have you ever tried to stop? And those kind of things help us to understand better that this is. So this actually helps us with our diagnosis and treatment plan. Yes.
All right. Now, all this one that you are talking about, why really do we need to stress ourselves concerning the issue of substance? After all, people use it for recreation. Is that not? What are the reasons why we are saying we need to screen, we need to assess, and all the, what are the negative things that drug causes that makes us say, oh, this needs to be done?
As much as we say that, okay, somebody is mildly using it now for dependence, but the truth is that drug use has more negative effects than it has positive effects.
Okay.
That's the truth. I mean, the chances of developing, kidney problems, all kinds of organ malfunction as a result of drug use. And the truth is that not everyone has the same threshold of tolerance when it comes to drug use.
Okay.
You understand? Somebody could have been smoking for 20 years, and I know of an old man who's been smoking for over 50 years. Not once has it become a problem. No cancer, no nothing, nothing, not even cough. You understand? But there are some people who just use it for 2-3 times and it becomes an issue.
Okay.
You understand? So what this helps us to do is also to identify these things and begin to put in place interventions. To like prevention. You understand? Because the truth is that it is becoming more and more a problem in our society, especially alcohol.
Okay.
Alcohol use. We educated, or we people in the field say alcohol is a drug. You know, a lot of people don't look at it as a drug.
Is it really a drug?
It is.
Okay. So
you understand? It is because it affects you. What's that word now? I'm trying to use. I don't want to say psychologically, but it affects your mental health completely. You understand? The way you function affects your function,
brain and the central nervous system.
Good. Yes. And affects the way you function.
Your thinking, your mood, and your behavior.
And your reactions.
Yes, of course, the reactions and all that are part of the behaviors. And so it affects those things negatively. And so it's a drug.
It's a drug.
Now,
anything that affects you psychotropically, that's what I was trying to remember.
Psychotropic drug. All right, so now you have said that these are drugs, but most people look at drug in terms of cocaine, heroin. We say they are hard drugs. Now you are coming to tell me that alcohol and even tobacco, cigarette, that they are drugs. So can you shed more light on this?
Like we talked about, we are talking of psychotrophy here. You understand? The same thing cocaine is able to do in the system. Okay, we have different reactions, quite all right. Alcohol does it.
Okay.
You understand? It affects the way you think, affects your CNS and your brain. So, what I mean?
Yes.
There really isn't any different. Just that okay, the symptoms will be a bit different and cool, and then probably the how do I put it now? The kind of high it gives, and cool, but essentially they still affect the same thing.
All right. So what we are saying is that it is actually society, maybe by law, that determined to say, okay, alcohol and cigarette, tobacco are illicit drugs.
Yeah.
If today the parliament in Nigeria or the Senate or the House of Assembly decide to say, okay, we want to ban this one,
It becomes illicit.
It becomes illicit. because we know that in America, cannabis has become
Illicit
in some states. So, however, for us, we know that, and for the general public, I can say without fear of contradiction, that many of us, we know many people whose lives have been ruined because of alcohol, because of cigarette and tobacco, not to now talk of cannabis and all that. So, in terms of how it affects the brain and the central nervous system, and even the organs of the body, hypertension, diabetes, heart failure, kidney failures, and all those kind of things. So both alcohol and cigarettes are all drugs. Cannabis and all those other drugs are all drugs. All right. So the essence is to say that because of the problem that they cause, both medical, social, legal, family problems, across board, if these are screened and we can assess and then get treatment on time, it stops these complications from happening.
So we can call this screening like prevention measures.
Yes.
Measures to help prevent, and not just prevent but catch.
Yes.
It's like detect on time. And cause it from escalating.
All right. Now, it seems to me, I'm going there because I know that you have a lot of background in the issue of HIV/AIDS and all that. Even in quote, fight against HIV/AIDS. How effective would it have been without handling the issue of drugs in the wake of people using injecting drugs, in the wake of people getting intoxicated and getting into unprotected sexual intercourse and all those kind of things? What is the relationship between taking care of substance problem and HIV infection and all that?
In HIV prevention and treatment, we have what we call key populations.
Okay.
And one of those key populations are injection. In fact, they are drug users generally, and some of them, and another or subset is injection drug users.
Okay.
Those who use injectables. And we know that HIV is transmitted through the use of through unprotected sex. Multiple partners, having multiple partners, sharing, needles and sharp objects, which are all characteristics, of people who use drugs. Because by the time one is involved in drug use, one of the things that drug use does is that it impairs your reasoning. You understand? And the tendency for you to take what we call risky behavior is higher. You will have multiple. In fact, some of those drugs even raise your libido. So more often than not, you have multiple sex partners. Unprotected sex most of the time, because your reasoning is not you are not reasoning properly at that time. And a lot of when it comes to injectable drug use, also share needles just to get a high. And of course, by the time you share needles, there's no way that there will not be transmission of infection.
Okay. All right, so you are saying in essence now that even the issue of HIV/AIDS that seems to have taken over the world at the time is linked with the issue of drug use. That's beautiful.
If I want to note something. I was reading the other day in Europe. I think it was 70%. Is it 70% of their HIV came in from drug injection drug use, and not even from unprotected sex.
Yes,
they had already covered the unprotected sex issues.
It's all right. So that's beautiful. Now, before we go on, I know that a few weeks. How long have you been in this organization?
A few months.
A few months. Aha. So now you talk with so much dexterity concerning screening and assessment and all that. What would you say is the reason for this?
Well, one, because we've We run a lot of trainings,
A lot
in-house
of trainings. All right.
and that has been very educative. That
Okay.
is interest.
Okay.
There's a lot of in-house trainings. One of them being what we are discussing now, and in fact many others.
Have there been other people from outside who have been receiving that kind of training?
Yeah.
Now I want you to talk about the training and how people, the kind of people that
Have been in attendance.
Have been in attendance. Why these kind of people are, I mean, why is it important for those kind of people to have the training? Why is the training also important for people out there? Because that's the idea, to say that people should.
Let me take, for example, the screening, assessment, and treatment planning. Has been very beneficial to professionals in the field. Especially maybe medical doctors, psychologists. Those generally who get involved. It's even quite beneficial even to school teachers.
Okay.
And youth leaders also who are always in contact with people generally. And then we also have the the main drug abuse education course.
Okay.
That has been very beneficial. It has one of the things I learned, because I came in from the HIV field. I had no education when it came to drug use, was that one, drug use was a brain disease.
Yes.
And secondly, that the victims, let me put it that way, are actually quite helpless when it comes to addiction.
Because it's an illness.
Yes, an illness. Has to be treated as such. It is not longer a matter of the will. That was a very clear eye opener for me. And also one other thing that opened my eyes was the percentage of women,
okay,
that were involved in it and were actually at a higher risk, of other infections. That was another eye opener. It was even here I also learned about the fact that the criminalization of drug use is more detrimental to the prevention of drug use than beneficial. As far as I'm concerned, then I was like, because drug use should be detrimental, it should be criminalized. But now I am in the other field now. Because I have learned.
So you are seeing it as a public health issue.
A public health issue.
So we should look at it from the angle of health.
Yes.
Treatment for the people who have the problem.
And not punishment.
So who should now be punished? Because you have NDLEA, the police and all that, who are still involved.
It should be the peddlers.
The peddlers?
Yes.
So people that supply it?
Yes, the suppliers, yes, should be punished.
But the dealers and all that?
But not the users.
Okay. That's beautiful. All right. So, what about the drug user, the people who have drug use problem themselves? Now, why do I say so? I've had a number of people who use drugs, people who are in treatment, who have taken this course, and it seems as if the light was just turned on
for them
in their brain. And in fact, one sent a message a few weeks ago to say, I have been so. In fact, more than a year clean. And this is somebody that have been in and out, and all that. So, from those experiences that I've had, it seems as if somebody is tending towards being dependent or even dependent and need more treatment, it could even be a cheaper and easier way of getting help that is needed.
Yes, and one of the things it does for them is it helps them understand better their condition.
Okay.
And like we say, substance use disorder is a chronic and relapsing disorder. Yes. That means that it's a long-term thing.
Okay.
You understand? And if they are educated in some, we've had relapse management, they get to understand that a relapse is actually part of the recovery process, and it is not the end of the recovery process. And all those things help them, stand up again when they fall, if they fall, and move on, knowing that okay, I can continue. There is hope somewhere. And I think that, a lot of them get to understand that if they stay true to their treatment regimen and go even after, rehabilitation and go, the greater possibility that they will still be able to function as useful members of society and one day overcome, the addiction completely.
All right. So thank you very much, Mary. We have looked at the issue of screening. We have looked at the issue of assessment. We are seeing that we have a screening, assessment, and treatment planning course
Yes.
that people out there can be part of it. In fact, we just finished a cohort this evening too, and there are other topics in the series. We have elements of psychosocial treatment. One will be coming up next week, and then of course the course one that was talking about drug and drug prevention,
Yes.
treatment, and care, whatever. So yes, if you want to be part of that, you can always boss us so that we can let you know how you can be part of it. We can also have that training for people in the organizations.
Yes.
We can in-house training for them in the organization. We can, schools, organizations, health institutions, even places of worship.
Yes. Even security organizations.
Security organizations and all that. But you can also come to our center as groups, and we can also train you there. All right. Now, we are talking about screening, assessments, and treatment planning. Why do we have to plan treatments? Shouldn't you just be that everybody goes through the same thing? And why are we emphasizing on treatment planning?
Because one is that every individual is different, and for mental health issues, presentations are different. People come from different backgrounds, different predisposing factors.
Okay.
For them. At times there are different what's the word I want to use now? Different conditions, in which they have to face.
Okay.
Or are presently facing. What would have caused them to get involved in the drugs. So treatment planning helps us individualize treatment. For treatment, especially when you're talking of substance use disorders, for treatment to be effective, it has to be individualized. If it is a group treatment, it does not meet the specific needs, of individual clients. It doesn't meet the specific needs of individual clients. That is why treatment has to be planned.
Okay.
So that it can meet the individual needs of each client and not all that. It give us a more effective result. And not just that, it also helps us in the evaluation process.
Okay.
To help us know if the treatment is working and how to adjust it and help make it better for the client.
Okay.
It gives us a more organized focus for both the caregiver and the client, because the client gets a better understanding of what is happening, why he's going through what he's going through, and what he can do to help himself also.
All right. So we'll be rounding off very soon, but I think we need to touch this area.
Okay.
What people usually talk about rehab, and when they talk about rehab, you see that people talk about minimum of 3 months, some spend 4 months, 5 months, and all that. What really are you people doing there? Well, I'm saying it in that light now because it's we and all that. But is it not just to say no to drugs and all that? Which areas are covered when we talk about these treatments?
Every area is covered.
Yes. When you say every area, what do you mean?
We are talking just like the assessment test we are talking about. It covers every area. It covers the individual's mental health.
Okay.
It covers his physical health.
Physical health.
It covers his social health.
When you say physical health, can you elaborate?
Physical manifestations.
Like what?
High blood pressure.
Yes.
Organ
Hypertension.
Yes, that's right.
So any other thing that we see?
Yes, we treat.
Okay.
We handle, even if they come up during rehabilitation. We treat, we handle.
Okay.
It even covers even their mental health.
Okay.
You know, it covers also even their education.
Okay.
We have clients here who we've registered. Through here they were registered for JAMB, and you know we discuss with the family. This boy wants to go to school, or he has to go back to school. We encourage them to go back to school. Some we have actually even their careers and their income generating abilities also.
Yes.
It's all part of rehabilitation, because the idea is that it's a wholesome thing. You know, you cannot just be mentally healthy and then you're not able to look after yourself, you know, economically or physically. It will become a problem, and it will begin to affect your mental health. So the idea is that let us handle everything that has the potential to affect the client's mental health, and that is his well-being. So where there are issues, we find ways, you know, where we can intervene, you know, interventions, working with the families,
Yes.
you know, to see how we can help in that area. Even protection issues.
Yes.
You know, when it comes to protection issues,
What do you mean by protection issues?
we are talking of issues of being scammed one way or the others. You know, we still try to go out of our way, you know, of course diplomatically, to see how we can, you know, find ways to intervene.
So
to
everything
protect.
is about protecting the client.
Yes, everything is about protecting the client.
Okay. It's all right. So thank you very much, Mary. I think that time is actually seems to be running out on us, because we are not likely going to go beyond 1 hour. That's okay. So now, yesterday was the International Day of the Boy Child, and there's no way we can be talking about the boy child without talking about the issue of substance abuse and all that, and substance use and abuse. As a matter of fact, I know that yesterday we had a podcast or a Zoom meeting where we talk about empowering the boy child for holistic development and well-being. And one of the things that area we discussed there is the fact that the boy child seems to be the one that is disproportionately represented in this issue of drugs. You have been working with young people, especially the male, well, both males and females, but tell us your experience in terms of substance abuse, substance use, and the boy child.
Well, I don't know whether it's an African mentality or it's general. I'm not actually sampled it outside, but I realized that the male species here, you know, is very sensitive about how he looks to his friends.
Okay.
You know, so peer pressure is a serious issue.
Okay.
You know, with especially our teenagers.
Okay.
You know, and because of that, you know, in a bid to look more macho, you know, in a bid to be more macho, look more mature amongst your friends, and they may end up trying things, experimenting. You know, one of the things they do is drugs.
Okay.
Another thing, sex. You know, so they are much end up experimenting. You know, in carrying out activities that actually will be harmful to them. You know, and if one is not careful about it, it becomes a problem.
Okay.
You know, because young men are also very good at emulation. You know, they have role models they're looking up to. And if these role models get involved in some of these issues, you find out that the tendency is that they will. Because I've also realized that a lot of females who get involved in this were actually introduced, not all, but most were introduced into this by their male counterparts.
Yeah, they are significant others.
Yeah,
maybe by love, people in love, relationship.
Yes, and things. So you find out that it's like they are, you know, I want to call them more at risk.
Well, yes, they are more at risk. There are a number of factors that make the man, the boy child that goes become the man now, to be at risk. Societal expectation.
Yeah.
Societal stereotypes. What do you mean by stereotypes?
The man, macho, you have to
Macho.
be
So
the
man is expected to be rough, to be tough.
Doesn't show emotions.
Yes, doesn't show emotions and all that. So boys don't cry, and so if the guy is hot,
the pressure is there.
The pressure is there and all that. So he turns it inwards. He takes alcohol. He smokes. Peer pressure. And it seems as if for you to be the G, you have to do all those kind of things. So it's a lot of pressure and makes the boy child to be at risk and all that. And so we know that many a times if you have people who have substance use disorders, if you have 4, 5 of them, 4 of them will be boys,
Males, yes.
males, as against just 1 out of 5 that will be female. So the boy child. So you have also gone through that course one that talks about drug prevention, treatment, and care. I think we have to talk about this at another time in full, but just in synopsis, what is the hope of how do we prevent the boy child into getting into these things? And we'll be rounding up with this.
Well, I think one of them, of course, education is important.
Yes.
But it's not just education also. Because we realize that a lot of them have it in their head, say no to drugs.
Yes.
And cool, and things like that. But I think one of the things is to put policies in place, that will make how do I put it now? I don't know how to explain it now, but policies in place, that will make drug use unattractive without it being criminalized.
Okay.
I think a lot of it still borders down to education, but not just about saying say no to drugs. No.
Just the slogans.
Yes.
You know that I like to say, I don't know, it seems as if it's almost useless to say.
Yes.
Because it doesn't address the complex
issues
that
issues,
happens with the drug use.
And I think also that it's not just about. I think we also have to handle some societal issues also. And the mindset, the mentality that people have carried, which has actually caused a lot of problems for our males. But just thinking as we're talking now, a lot of males have the pressure of breadwinner.
Yes.
In a home. They are stretching their hands in so many different areas. The family behind is here, the wife's family is here, his own family is here, his personal development is there, and everybody looking at him as the man. Like Budaya said in one comedy, he says, "We shall not die in the meaning of bread." So that pressure is more. A woman is hailed if she's helping to look after the home. Say, you are trying, or your wife still supports you and everything. Everything is expected to be on the man. Of course, women also have our own challenges and co. But is it that pressure, you understand, is enough to push the boy child to I just need to ease off.
All right, so time seems to be running out on us, and we have been talking about the issue of screening, assessment, and treatment planning in drug use disorders. And I'll be talking with Mary Idoko, who is clinical psychologist at Netwealth Medical Services and Rehabilitation Center, and also the programs officer of the Netwealth Rehabilitation Initiative. Mary, thank you very much for having a good discussion with us. Like we said, yesterday was the International Day of the Boy Child, and tomorrow I will be speaking at Air Force Secondary School at the instance of the Medical Women Association of Nigeria, Plateau State Chapter, talking about prevention of drug use in the boy child. And so, of course, that by 9 o'clock or 10 o'clock in the morning, we'll be doing that. And then, of course, next week we also have the elements of psychosocial treatment, which is the third in the series of drug treatment and recovery course that we have been running at Netwealth Medical Service, Netwealth Consults Limited. All right, so viewers at home, this is the much you can take concerning the issue of screening, assessment, and treatment planning in drug use disorder. The message here is drug use is endemic. It is all over the place. You may be shocked that that's your well-behaved son, well-behaved daughter, well-behaved spouse may be involved in the issue of drugs. It is good to screen, get them at early stage, and be able to intervene early, such that it doesn't go on to cause complications, disruption of family lives and all that. So the message is make sure that you live a clean, healthy life devoid of drug and its complications. So until we come your way at another time, same time on the same um, channel, make sure, like they say, you see no drugs. Thank you very much.